Now we're on to a condition mostly discovered in the toddler years. This is Duchenne muscular dystrophy. So this is a genetic disorder causing progressive muscle degeneration and weakness. So when you think dystrophy, I want you to think degeneration. So what do these clients look like? Well, we'll see this classic Gower sign. This is a hallmark sign of Duchenne muscular dystrophy. So we'll see that their legs are so weak that they need to use their hands to rise. So in order to rise from the floor to a standing position, they need to use their hands to walk up their body, something like this. Then, as they begin walking, we will see gait disturbances like waddling and frequent falls from that muscle weakness. This will eventually lead to a loss of ambulation by adolescence. Remember that dystrophy equals muscle degeneration, meaning this is a progressive condition with no cure. So what are these clients at risk for? Well, because they have so much weakness, we're worried about that fall risk. We are also worried because that weakness is in the respiratory muscles as well. So we're worried about respiratory infections also. So our treatment for these clients is mainly supportive. So we give corticosteroids to help delay that muscle degeneration. Because this client's having muscle weakness, we need to teach about the use of assistive devices, things like ambulation aids and wheelchairs. Then we need to promote home fall prevention and do things like removing throw rugs. Remember, they don't just have muscle weakness in their legs, but also in their heart and their respiratory muscles. So we are worried about cardiopulmonary complications like cardiomyopathy. Then we also need to monitor for signs of respiratory infection like cough or fever, because these can be deadly in these clients. So for our first NCLEX quick check, take a moment to answer these questions. What interventions do you anticipate for a child born with clubbed feet? Well, remember, with clubbed feet, we are needing to return that foot to a normal position. So they need to undergo serial leg casting. And remember, any client in a cast, we're worried about two things. That's skin integrity, and very important is that monitoring neurovascular impairment and those 6 Ps, things like pallor and paralysis. Then, how does the nurse position an infant's legs in a Pavlik harness? Well, remember that hip or H. It's the shape of the H, so the legs are flexed and thighs abducted or apart. Then, what is the hallmark sign of Duchenne muscular dystrophy? Remember, they are so weak in their legs that they have to literally climb up their legs to a standing position. So that is that Gower sign.